Thank you, Mr Deputy Speaker. It's my privilege to be able to finish my contribution to this debate this morning, having been interrupted by events of last evening. What I was talking about last night was the appalling cuts to Aboriginal smoking programs by the Abbott government in 2014. And I note the amendment which has been moved by the Shadow Minister, which says that whilst not declining to give the bill a second reading, the House, 1, notes the progress on lowering smoking rates has stalled following the government's cuts to tobacco control measures, and 2, calls on the government to reinvest in lowering smoking rates. Now, I should say, Mr Deputy Speaker, of course I support that amendment wholeheartedly. And what they could do is look at examples of best practice examples of programs which have been very effective in impacting upon smoking rates among some communities. And I want to point particularly to one program which has been developed by the Institute for Urban Indigenous Health in Brisbane called Deadly Choices, which explores the historical journey of tobacco use, its acceptance and its impact on Aboriginal communities. It's a tobacco education program which is available into schools. It's a health education and capacity development program that gives participants an understanding of the long association with tobacco and Aboriginal and Torres Strait Islander peoples have had, which helps them gain insights into the current use and acceptance of tobacco in community. But Deadly Choices is bigger than that. It's really a health prevention program, a health promotion program, which spins around the need to address tobacco. The one-term six-session program for schools is delivered in a flexible manner to suit school and community environments. It talks about the history, impacts of smoking, chemicals and addiction, quit support and health resources, passive smoking and deadly places, smoke-free spaces. It involves a 715 health check and developing links with Aboriginal medical services or health centres. And that's a very, very important thing, because what we need to do is understand the relationship between primary health services and prevention, and the way in which you can spin off programs like Deadly Choices as a result of attracting people in to get a 715 check and give them the opportunity to take action to safeguard their own health. One of the comments there was a systematic review in 2016 of these programs, and I want to quote some of the conclusions. With many of the interventions analysed in systemic review report high levels of community engagement and ownership, interventions that led to positive changes were: 1, led by Indigenous community members; 2, implemented in partnership with Indigenous and non-Indigenous health workers; 3, offered as mainstream health services. However, the importance of Indigenous-led commercial tobacco control interventions is threefold. First, it demonstrates a growing recognition of the need to address the high rates of smoking in Indigenous communities, which I explored in my earlier contribution. Second, it recognises that interventions will have greater community relevance if programs are supported and rooted in local community context. Third, it reflects the growing demand made by Aboriginal communities for control over health services through the full participation of Aboriginal individuals in decision-making and implementation. Further, consistent with approaches to Indigenous health knowledge translation, this review found a preference for within-community messages. This is made evident through the frequent use of culturally relevant health promotion materials that were adapted and reflect the community's unique history and culture, as well as the use of Aboriginal project staff and research officers in many of the interventions. And that's what Deadly Choices does, Mr Deputy Speaker. And it's built around the expertise and drive of an organisation which is very ably led by their CEO, Mr Adrian Carson, but has got a wonderful board, a skilled board, which has got people who are outside of the not only Aboriginal people, but it's a skill-based board, and I think Bill Glasson, who's a noted eye specialist in Brisbane, is on the board, plus others. And what it says about this organisation is how they've been able to work around the funding arrangements for the Commonwealth to make sure they have a program which is effective, makes an impact, and will reduce and has reduced smoking rates in their community. And that's what this is about. And I say to the government, you have an opportunity here to redeem yourself. And the way you redeem yourself is by putting additional resources into programs like Deadly Choices, not only in Queensland but elsewhere across Australia, and other programs which are community-owned and community-driven.
I thank the member for Lingiari. The question is the amendment be agreed to. I call the member for